Staff will not know whether they're giving adrenaline or they're giving the placebo drug. Essentially, they will have a drug pack in front of them. The drugs will look with the exact same presentation, so staff won't know what's in those vials. They will give those vials to the patients. It's only later, when they reconcile the numbers on the drugs, that the trials unit will be able to determine whether or not the patients had adrenaline or they had the placebo. That's the only way we can ensure that there's no bias introduced to the trial.
The main concern that people initially raise is that, but we're not giving adrenaline to patients, and that's what we've always done. And that's the problem, that we have always done that, but it's never been trialled. We don't know whether adrenaline is safe. We don't know whether it improves outcomes for patients.
Staff needn't be concerned. The trial has gone through all the necessary approvals processes. It's been to an ethics committee, it's been reviewed by them, and equally the Healthcare Professions Council have indicated that it's appropriate for paramedics to participate in an ethically approved trial. This trial has all of those approvals. It's also had local approvals from West Midlands Ambulance Service and the local research network. So staff who adhere to the protocol have nothing to fear.
Before paramedics actually take part in the trial, they'll be given some training in that. It'll be an hour and a half of training. However, that's not the end of what they can learn about this, or if they've got questions, they can ask questions at any point. We've got a research mailbox that they can email. We've got the research paramedics that are in place will be around on the stations. Their contact details will be there so they can email or phone them, or just catch them on stations and ask whatever questions they've got. We certainly don't want paramedics to be concerned about taking part in the trial. There isn't any reason for them to be concerned about taking part in the trial, and hopefully we can reassure them and we can answer any of their questions about that.